Great, thank you.
All right, I think I'm going to take the lead here for the first 5-7 minutes, and then I'm going to try my best. Anybody who knows me knows I'm not real good with brevity, and many of you that have seen me before at the Type 1 Summit in person, you probably know me as the guy at the end who gives away the iPad. That's kind of my claim to fame. We're not giving away an iPad tonight, but maybe we'll have a couple tricks up our sleeve. My name is Jeff Hoomaian. I work for a company called Healthy Living Medical Supply here in Detroit, Michigan. We are a local diabetes supply company in what's called a DME. We'll learn about that in just a minute. We're truly dedicated to those with type 1, and that's where my passion comes into play. I've been doing this for 20 years. I get a lot of people who ask me all the time, why are you so passionate about this? And I have to be honest with you, it kind of goes back to having a lot of different jobs. And somewhere around 20 years ago, I found this industry and finally found something that I loved and that I could actually get paid to help people. And from that point on, I never looked back and never wanted to go anywhere back. So I love what I do. I really enjoy helping people, helping those with type 1 especially. And that's why I'm here tonight, and that's why I'm dedicated to do what I do. One of the other things I wanted to talk about is that how this is a little bittersweet for me. I must be honest, I've sat on the planning committee for the JDRF Type 1 Summit here in Detroit for about 10 years, maybe 11. And the summit is literally the best day of the year of my life. I love the summit. I live for that day. I help Denise plan it and arrange it, and we do a ton of fun stuff. So when I heard it was going to be canceled, I was a little bit disappointed, but I'm so happy and so glad that we were able to put this together for you. My experience is real world. I try to learn as much as I can about, I'm not a doctor. I try to learn as much as I can about the insurances, the other things that I can be an expert on and to help you. And this situation, this topic, this understanding the maze of diabetes that we're going to talk about tonight is exactly how I can help. So I pulled together as much information as I could that I think you'll be interested in, and then we'll bring in our panel and we'll talk about some more too. As I go forward, you'll see that I will have my email listed on each of the slides. So feel free to email me anytime, preferably not tonight while we're going, but if that's what you have to do, about any of the topics that we're going to talk about, any questions, anything you're interested in, be happy to either help you directly or guide you to the right place. So, oh, and the other thing is, I have to thank the JDRF. I'm so appreciative of allowing me to do this and take a shower for the first time in 3 weeks. No, I kid. Not 3 weeks, maybe 3 days. Obviously, I haven't shaved, and unfortunately, I'm not going to shave because my wife actually thinks she's married to another guy right now, so she would like me to keep this. So, so I'm going to go forward with I'm going to switch to the screen share. All right. So there we are, Understanding the Insurance Maze. I entitled this, Your Ultimate Weapon and Advocacy Arsenal. Like I said, my name is Jeff Hoomaian. I work for a company called Healthy Living Medical Supply here in Detroit, Michigan. Here's your first insider insight. This is one of the things that I love to share, things that you may not know, you might want to know, things that people are probably in the industry only know. What is DME? We're going to talk a lot about DME. That is the part of your insurance that generally pays for your diabetes supplies. It stands for durable medical equipment. It also the same insurance that pays for oxygen, prosthetics, those types of things. And I got to be totally honest with you. One of the things I hear about all the time is because there's so many people with diabetes, people think, oh, there's so much money. You guys are making so much money. Everybody wants to do this. No, there really isn't. Over the past 10 years, more so than the past 20, but definitely the past 10, maybe 5, reimbursements keep getting cut and cut and cut and cut, in some ways so low that there's certain products and supplies we can't even supply because the reimbursement rates have gone down that much. What we do to make money and stay in business is, again, a dedication to service. We're there for you to keep your disease in check and to give you the tools and technology to do that. So one of the ways that we can make money is by providing a good service, and the longer you stay with us, the more we can make money and stay in business. And that's what we do at Healthy Living. There's many other companies that do what we do. Obviously, I'm a little biased because of our dedication to diabetes and being local here in Michigan. But just one little myth buster for you. Before I even get going too far, I wanted to give you guys a brief history on health insurance, how we got to this place. Way back in the early 1900s, networks were established. First by hospitals, that was what was called Blue Cross, and then by physician practices who wanted to keep up, that was called Blue Shield. Those entities started offering insurance plans or some form of an insurance plan to their members or employees or patients. How did we get to employer-based coverage? It's actually kind of weird. During World War II, there were wage controls set that didn't allow businesses to pay people or give them raises. So companies had to think outside the box and get creative with trying to give an incentive to employees to either come to work there or to actually stay there. One of those incentives was to provide them with some sort of health coverage. And that's, whether it's good or bad in this society today, that's how we came about with the employer-based health coverage. For those of you outside Michigan, I'm sorry you're going to hear me talk about this quite a bit tonight, but it's where Michigan is completely different than every other state in the union. There might be Texas, Florida, Ohio, or other heavily DME states, but Michigan is definitely the highest use of DME state in the country. This was generated basically back in the 50s, 60s, and 70s with union contracts that were negotiated mostly with our big 3 automotive companies. And there are a couple of DME providers here in the Michigan area where the contracts basically stated that these things had to fall under durable medical equipment, and diabetes supplies was one of those. One of the other things that changed recently was the implementation of competitive bidding. This was on a national scale. Medicare moved to this back in 2004, 2005. It was under President Bush. When they passed the prescription coverage for Medicare, they had to figure out a way to pay for it. So they put through this thing called competitive bidding, where every single line item in the DME world was going to have to be bid upon by companies to be able to service that. Those of us in the diabetes industry at that time thought this was going to be a giant cluster, and we kept our fingers crossed, hoping that this would not ever come to fruition and was going to be eliminated before it even came to play. Unfortunately, that got delayed and got delayed and got delayed until about 2012, when Obamacare came out, and the Congress passed through the competitive bidding. And what you've seen is a severe reduction in reimbursement rates and a severe reduction or increase of criteria, what people can get. I think Tammy actually talked about it in the last one. The last session, if you guys were on, she mentioned something about certain insurances only paying for certain things. That's usually because the reimbursement rate that we're getting paid as a company is actually lower than the cost of the product that we're paying for.
Hey, Jeff, your video has gone off.
My video has gone off.
Like of you personally? Yeah, turn your video on.
Oh.
Your thing is showing, but your video of you isn't, so they can't see you as you're talking.
You know what? Because I'm controlling it from an iPhone, I think it's going to.
Okay, got it. That's fine then.
Sorry. Okay. Last but not least, the other thing that happened recently, I can't remember when this happened, probably 5-7 years ago, but there used to be a program. It was the Blue Cross card and Blue Cross reciprocity. What basically that was is if we were here in Michigan and we wanted to build Blue Cross and we had a Blue Cross contract, it didn't matter where you were, what Blue Cross you had, we could bill through the Blue Cross of Michigan because that's where our contract was. And somewhere down the road, Blue Cross of Nebraska, if that's what you had, reimbursed Blue Cross of Michigan for the coverage, and they evened that out on the back end. Well, what we noticed was, and we kind of, people that I was working with at the time, we all looked at it and said, oh, this is going to be something that's going to be canceled. And sure enough, a couple of years ago it was. The state of California was paying $6,000 for an insulin pump, and the state of Michigan was paying $4,000 for an insulin pump. That could be because of many different reasons, cost of living, who knows. But at some point, these states that had a lower reimbursement cost, at the end of the year, they're looking at their spreadsheets and they're like, why are we paying, more and more, $6,000 for an insulin pump when they're, our cost is, or our reimbursement rate is only $4,000. So what they did is they removed that reciprocity, and now the rule that we have to follow, or the rule that you need to know, is that you can, if you have a Blue Cross policy, you can only be serviced by a provider in the state in which you reside. There are some grandfathered cases, some large national mail order companies that may have Blue Cross contracts in different states that they have been grandfathered in, or some of the manufacturers have grandfathered Blue Cross contracts. But generally speaking, if somebody came to me from Ohio right now and wanted service and they had Blue Cross, we could not service them because we're in the state of Michigan, and that patient has to live in Michigan for us to service them with Blue Cross. That was a pretty major change because really the only thing that you can service nationwide with a contract is Medicare and maybe a few others. All right, here's another insider insight. The importance of brick and mortar. This kind of goes along with that topic, but really follows most Medicaid plans, definitely follow this rule. Many insurance plans have brick and mortar rules in place for medical providers. Simply stated, this means that the provider actually must have a physical location in the state in which they serve those patients. So the biggest question that I get asked all the time is somebody like on an insulin pump or on a CGM and says, well, why can't I just get my insulin pump or pump supplies or my CGM supplies from the manufacturer? Why does there have to be a middleman? I don't understand. Well, sometimes that is the case. You can do that. But more often than not, you can imagine those companies would have to get a contract in every single state to be able to do that. That's why they rely on us as a distributor, because we have those local contracts, and they partner with us to be able to provide in those states. Like I said, most Medicaid plans, especially here in Michigan, all the Medicaid plans follow this rule. You have to have a location in the state of Michigan to be able to provide for those patients. And I'm one of those people, I like to tell you guys real world stories. I just got an email today from a patient that I can't stand giving them this answer, but it's a patient with United Healthcare. United Healthcare has an exclusive agreement with both Edge Park and Byram, two of the largest, well, actually the two largest durable medical equipment providers in the country. Both of them do full service DME, not just diabetes supplies. And the family has Children's Special Healthcare Services, which is a fee-for-service secondary that picks up copays and deductibles for that their primary doesn't. Well, there's not a provider in the state of Michigan that can do United Healthcare as a primary. So here this family is, they can either go to Edge Park and get their supplies, but have their full, they have to pay their copays and deductibles that normally would be picked up, or just get rid of their Children's Special Healthcare because it's not doing them any good. Those are the types of things that we face all day, all the time, and try to make more simple for you guys to understand. I hate that one, it drives me crazy. We'll talk about advocacy a little bit later. All right, It's a little crazy. You guys think it's Halloween, right? Actually feels a lot more like Groundhog Day, right? But when I started getting into this, I started thinking about all the different scary topics and the scary terms that are thrown out there that people have trouble understanding. So I went with a Halloween theme, and we're just going to talk about some of the things that you might want a better explanation of. Some common terms in our world: deductibles. That is the amount of money you pay before any of your insurance payments kick in. Might have $1,000 deductible, you might have a $2,000 deductible, you might have a $5,000 deductible. I've seen people with $10,000 deductibles, $14,000 deductibles. Those have continued to go up as the last 20 years. I remember early on in this business making calls to patients and telling them they had a $500 deductible and cringing because I didn't want to hear their sadness on the other end of the phone. Nowadays, $500 deductible is like, that's gold insurance. If you've got that, congratulations, keep it, you're doing great. Copays or co-insurance. The difference between here is pretty simple. A copay is a set fee, like a $40 copay. Co-insurance is usually a percentage, and that's where usually in DME, once you meet your deductible, then you have copays following. So you could have a $1,000 deductible, and once that's met, you pay a 20% copay of the rest of your supplies. Oh, I forgot my sound effects here. Get you guys some scary sound effects to go on. MOOP, that's not a fancy name. It's just an acronym for maximum out of pocket. This is the total amount of money you can pay in any calendar year or a contract year. So basically, again, let's give you an example. A guy has a $1,000 deductible, 20% copay, and just for ease of math, let's go with the $2,000 maximum out of pocket. So he's going to pay that first $1,000 out of pocket, and he's going to pay 20% of the reimbursement rate for the rest of that calendar year until if and when he hits $2,000 out of pocket. Once he does that, he's 100% covered. I will tell you, I get a lot of people coming to me that I've met with to talk about pumps, to talk about CGMs, two really high cost products in the diabetes world. And they'll come to me in October, November, and December, and hey, their deductible's been met. They're so happy they want to go ahead and get a new pump or a new CGM. Great. It's awesome. 100% coverage. Who doesn't love that? I'll be honest with you. If it were me, and you know, I don't live this, I can't make those judgment calls for you, but I would rather get that out of the way at the beginning of the year, pay as much as I can, as long as I've saved up, because then I have 100% coverage for the rest of the year. I'm maximizing my insurance to the best of my ability and for the betterment of me. This really is an interesting term, warranty. I put it on here because we get this question quite a bit. Why can't I get a new insulin pump? Why can't I get a new CGM? When can I get one? The warranty period is the period of time that something is covered by the manufacturer. The problem with that is, as insurance companies have reduced their reimbursement rate, and as they've put more criteria, more restrictions on what you can and what you can't get, one of the things we found is that they will not pay for something if your current product is still under warranty. That goes for a CGM. If you have a receiver that's been billed, Medicare, it's covered for 3 years. You can't get a receiver billed to Medicare for 3 years. And insulin pumps, all the insulin pumps usually have a 4-year warranty. So most of the time you're stuck with that warranty you're stuck with that insulin pump for 4 years until your insurance will pay for a new one 4 years later. I will give Tandem a plug right now, just because they were the first company that came out with updatable program or updates instead of upgrades. So one of the things that I thought was great is they were able to go to the FDA and get approval for their, basically what we do with our phones and iPads and things, where you can get a software update to their new software as opposed to actually going ahead and getting a whole new pump. And that kind of removes the possibility of you getting a pump in year one, them coming out with a new fancy, more higher featured pump, and still stuck with that for another 3 years before insurance pays for it. Last thing is PAs and authorizations. It's just prior authorizations and authorizations. These are required by certain insurance plans, It's a process of approval given to a DMA to provide supplies. And we're going to talk more about those in the next slide. Insider insight, another scoop for you guys.
Dr. Hoomaian,
PAs, yes.
sorry, I just want to give you a couple-minute warning because time is running down, and I'd like to bring up Jacinta and Emily also.
Fantastic. I will get through this and actually move forward.
Great, thanks.
All right. So there's a lot of miscommunication, misunderstanding about prior auths or just getting auths. It's often dependent on the provider that's working the file. We have to look at legal interpretation. Other companies look at legal interpretation of different rules and criteria differently. And I just wanted to kind of go over, there's a certain level of risk and fear of audits. Two of the biggest things that us as a company are always worried about are what's called extrapolation. Both Medicare and Blue Cross do what, instead of audits, well, you know what, I'm just going to go ahead and skip it. It's just very difficult to go outside the box and go outside the rules. So a lot of times patients will come to us and say, well, why can't I do this? Why can't I do this? We have to follow those rules to a T, or else, again, I could go into a complete rabbit hole here, but we will get really burned down the road through an audit or through the extrapolation from an audit. So sometimes I bring this up because sometimes providers will actually use this as an easy out. They'll just say, sorry, you're not covered, you don't meet the criteria, and move on. So it's good to know those things and have advocates for you, which we'll get into. Help for you, finding an advocate. The JDRF has a phenomenal website. I put it there. I will actually also try to link to it after the slideshow's over. But if you go to jdrf.org, up at the top, there's a bar. It says Type T1D resources. You can actually click on insurance straight from there. But if you go to the Life with T1D and then insurance, you'll find a page that is loaded with information. JDRF has their entire website available. They have an advocacy team, networking coffee groups that you can join, Facebook groups, and obviously the summits and other places where you can get information. Your provider, finding the right provider and developing a symbiotic relationship. Usually there's a customer service team or a reorder team, and you want to find the right person who's going to go above and beyond for you. Your doctor's, insider scoop. When you're dealing with your provider, be diligent, but also be kind. I recommend keeping meticulous notes when speaking to your provider. Record your dates and times of your calls. Every provider I've ever worked for, we record our phone calls. So if you have the date and time of a call, the management can usually go back to that call and see what was said and what was actually supposed to happen. Write down the names of anybody you speak with and seek help from a manager when necessary. Last but not least, your doctor's office. Find the key person at your doctor's office. Your physician and your nurse practitioner are always great. Your CDE, which are now I'm having a really hard time after 20 years being in this business, calling them CDCESs, Certified Diabetes Educator, or their new name, Certified Diabetes Care and Education Specialist. Your medical assistant, sometimes there's a document specialist that works with the doctor getting the documents that the provider actually needs. And sometimes there's a social worker there that can help you. So speaking of, those are the other two people on the call today. I'm just going to give you guys a little bit of background on these two people just because I love them dearly. Emily is phenomenal. She's one of the CDEs and the program manager at the University of Michigan's Adult Endocrinology Clinic. And one of my favorite stories about Emily is I've called on her for years, and I don't know when it was one of the meetings that we had, probably 2, 3, 4, 5 times down the line. I just looked at her and I said, you know a lot about this stuff. I mean, most of the time the CDEs and the doctors are coming to me for, I'm going to switch you guys back to, there we go. Most of the doctors use me as, somebody that can help and educate them and consult with them on some of the topics that we've talked about today. Again, being an expert in providing them with inside scoop on how to refer somebody for a certain product or a service or whatever. And CDEs are no different. And when I was meeting with Emily, I just looked at her straight in the eye and I said, wow, you are smart. You get this, not only from a CDE perspective, but you really understand this. And she kind of looked at me and said, Jeff, you know, I'm type 1. I said, oh, I did not know that. So she is phenomenal because she provides, you know, diabetes education. She works in an adult endocrinology clinic, and she provides the life experience of understanding this stuff. And then Jacinta might hate me, but I pulled out a really cool thing we did a couple of years ago. It's called My Diabetes Superhero. We put together a book, and I'm just going to say that Jacinta is such a great advocate for their patients, their pediatric patients, that this last line of this essay, she doesn't have to do any of the help that she gives me because she's not a doctor or a nurse. She just thinks I'm someone who is worth her time. That's why she's my diabetes superhero. So with that, I'm going to turn it over to Jacinta. I think she has a lot more help and assistance on the pharmaceutical side and the medication side that she can give us, and look forward to hearing from her.
Thanks. Wow, that was quite the intro. Okay, thank you for that. That was a really nice lead in. So yeah, so I'm one of the 3 clinical social workers at U of M, Peds Endo. We are a multidisciplinary team, and we are doing a lot of telehealth these days, as many providers are. And if you're wondering from the patient perspective, insurance coverage has expanded greatly for that during this time. So if that's something that you're interested in, I know that there's a big push for it right now. And I know the talk just prior to us, it sounds like a lot of people are really enjoying taking part in those. So if that's something you're interested in, we would definitely encourage you talking to your insurer and your provider to see if that's something that you can do. Also, HIPAA and confidentiality restrictions have loosened with that as well. Yeah, so we're doing a lot of telehealth these days. We still do a lot of insurance navigating and helping people through barriers with insurance, children's special health care, which Jeff mentioned, and I'll talk about as well really quickly in a minute. So we're also looking into we've been compiling resources for assistance programs during this time especially. So I'll give you a little bit of a highlight of some of those things that we've compiled. A lot of them are on the JDRF website that Jeff showed you, but there's a lot of info out there. So being able to kind of distill it down, I'm hoping I can give you a little bit of an overview. So first, Children's Special Health Care. What that is, if you're not familiar, it is, so CSHCS for short. It's a program in Michigan for any child with a chronic condition from birth to age 21, 21st birthday. And essentially any of our patients with any type of diabetes diagnosis are automatically eligible just by virtue of that diagnosis and it being a chronic condition. So what happens is essentially it comes in as either a secondary or tertiary, depending on whether you have 1 or 2, private or commercial insurances or Medicaid currently. And it's essentially a cleanup. So everything goes through your primary insurance or secondary per usual. Whatever's left over that you typically pay out of pocket, they would pay on your behalf, and it still counts toward your deductible. It's just specific only to diabetes. So diabetes care visits with your endocrinologist, specialty visits only. Ophthalmology, if they can bill that once a year, depending on where you go, that should be covered as well. And then all of your insulin prescriptions, your glucagon, your pens, your syringes, all of that should be picked up as well. Currently, all of the pumps are also picked up. The balance for those is also picked up by Children's Special Health Care. Omnipod didn't used to be covered, but it is now, thankfully. The only thing that's not covered on a standard basis still is the CGMs. So that is something that a lot of people are working really hard to change and have been advocating for a long time. We're hoping to see that change come soon. Can't come soon enough. It should just be standard of care, but we're hoping that will happen soon. Right now, as it stands, there are a number of criteria for approval for Children's Special Health Care for CGMs. You have to be under 5 years old, have hypoglycemia unawareness. There's a number of other kind of caveats you could meet. And there are a lot of families that are trying to do case-by-case reviews specifically of their family, their child, if there are, sensory issues, other things that require them to be able to use that as a tool to communicate about management safely, then we've been able to have some of those successfully covered as well. But it's not a standardized thing yet, unfortunately. So children's special health care, if you have Medicaid already, it's sort of an add-on. It's very easy. It just happens when your provider sends documentation of your diagnosis, and it's added on. It's there basically as a safety net. If you lose your Medicaid at any point, it provides the same support in terms of covering everything. It won't cover something, however, that your primary doesn't first cover to some extent. So that's important. So even though they'll cover the pumps, if your primary doesn't first cover it to some extent, then they won't pick it up. And then if you do not have Medicaid or you have a private commercial insurance, then you can opt into children's special health care. And you opt in by agreeing to pay a premium or a fee based on your family size and income. If you're a dual household, it goes by the parent who claims the child on the taxes, the most recent filing. And then, so essentially what it comes down to is whether or not your premium is more or less than your co-pays or deductible. So when your child or you turn 18, that premium is based solely on the child or the teen's income, even if still living at home and with the parent. So that usually benefits people from 18 to 21, if not before then. So definitely be talking to, that can be billed anywhere in the state of Michigan as long as the provider has a Medicaid contract and as long as they're an endocrine specialist. So your primary care doctor, for instance, wouldn't necessarily be included in that. So just be aware that that exists, that it's a really great tool. And even if you don't benefit from it today, perhaps if there's a job loss, if something else changes, it can be a great tool. It doesn't require that you have a primary insurance in place. It's always available if you have diabetes. So be sure to reach out to your team if you have any questions about it. It's a really great program, something Michigan does really well. Okay, so moving on, real quick mention about supply chains. There is no disruption as far as we're aware to the global supply chains for diabetes medications, including insulin. Where you're seeing some delays, I think sometimes would be on the provider end, a little bit maybe longer turnaround time for responses to routine things. And that could be a function of an influx of more calls and people needing support, or it could also be that staff might be redeployed or redistributed to help with the pandemic, or maybe home and providing childcare or be ill themselves. So just keeping that in mind. And then the other end would be, of course, the pharmacy end. So the main thing that we're seeing there is mostly reports of being out of stock. So a few kind of tips in being proactive with that. Call your endocrine office, make sure that your prescriptions are up to date and that you have the maximum allowed number of scripts and quantity within those scripts. Keep in mind that your provider can write a prescription for whatever it is that you request in terms of amount, test strips, that type of thing, but it doesn't mean that it will necessarily be covered or approved by your insurance. Many insurers right now, so this is a key, Cigna, Aetna, Blue Cross, Anthem, UHC, Humana, to name a few, have announced that they're waiving early refill limits for 30-day scripts and encouraging the 90-day scripts, and encouraging that you enroll in mail order. They're also loosening prior auth restrictions. So like, whereas you normally had to wait up until a certain window right before you're due for a refill to get the other processed, those are more flexible now. So try to take advantage of that if you can. And then contacting your insurance or your pharmacy to talk about what changes they've made with the pandemic, because a lot of them have specialty like patient assistance programs that I'll mention going right now. So that would be something that maybe you could get in on, at least for the time being, that might provide a little bit of a break from what you're typically paying. I would call in advance for your refills for sure, and then ask your pharmacist if they say they're out of stock, ask them to put in a request from their wholesaler. That may help expedite things a little bit. And definitely, you know, a good pharmacist cannot be underestimated in terms of what they can do to try to support you. So definitely be kind to them, reach out, kind of see what they have to offer, the coupons and things that they have at their disposal as well. And then again, consider signing up for mail order potentially too, which is something you might not have thought about before. So job loss, I mentioned that's coming up a lot right now during the pandemic. And then with that typically means a loss of insurance. I will say that most insurances, when you lose your job, the coverage is typically maintained through the end of that month of employment, sometimes longer, but typically just through that month. So take advantage of that window of time to refill your prescriptions, get some things in order, get as much as you can. I wouldn't say like stockpile, but people tend to kind of like get as much as they can so that they have it if they need it to bridge a gap. But that's a good time to take advantage of that. And then possibly you can join your spouse's coverage if you have a spouse. If you're under 26, you can get on your parents' plan. even if you're married. So your spouse or your children cannot, but that's something to think about too. If you just need it for you, for diabetes care, to kind of cover things, that may be something to think about as well. There's Cobra, so that is very expensive. A lot of people know about that. Essentially, that just continues the same coverage you had with your employer, but you're paying the full premium, the full rate. So that can tend to be very expensive. A cheaper potentially option, if you look on healthcare.gov and you look through the marketplace, there are a lot of options there. Still maybe sort of expensive as well, but it could be an alternative. And you may also be able to get tax credits to help pay for a plan there. And then applying for Medicaid as well. So even if you aren't eligible, your child may be eligible, or if your situation has changed, it's worth putting an application out there. The worst that they can say is no, and you know worse off. But and then considering children's special health care enrollment as well. I mentioned the assistance programs. So really quickly, all 3 top insulin makers have offered programs right now. So Lilly has the Lilly Cares and the Lilly Savings Card. So they're offering most of their insulin for $35 a month copay if you have any private or commercial insurance or don't have insurance. And then Novo Nordisk is offering a free immediate supply of insulin for at least 3 months, can be longer if you're denied Medicaid. For those who've lost insurance, you must show proof of job loss, though, related to COVID-19, or have started paying into Cobra for that to take effect. And then Sanofi has long had for lower middle income families or patients to qualify for also getting insulin for free or at a reduced cost. So the additional things to keep in mind, I mean, there are things like you can go to Walmart and buy MPH or regular Novolin for $25 without a prescription, without insurance. But just keep in mind that they work differently from analog insulin. So it's not something you would want to just go and do on your own. You'd want to talk to your endocrine provider before doing that so that they can help you figure out how to translate that in terms of your there's also things like Johnson & Johnson Patient Assistance Program, Partners for Prescription Assistance. There's a number of different databases online, RX Assist, Needy Meds, a whole host of them that essentially are databases of discount programs and coupons for a whole, every medication almost you can think of, including diabetes. So that's something to look at whether or not you're thinking about it during the pandemic. And contacting the manufacturer directly as well, which the numbers are on the JDRF website. So yes.
I'm sorry. I'm just going to give you the same way. We're running down on time, and so we need to flip over to Emily when you can.
Perfect. That was it. Actually, I just wanted to say to then basically utilize your resources. So just like Jeff said, the JDRF has a great online kind of synopsis of each of these topics. The ADA has one as well, and you can call them, talk with someone on the phone as well, your diabetes team, and then, utilizing each other in the community because, our parents and families, you guys are the ones doing the hard work every day and navigating this, and tips and tricks that we don't. So use each other, help each other, and then let us, we're here to help you whenever you need it to. So thanks.
All right. Thank you, Jacinta and Jeff. As Jeff mentioned, I'm Emily Weatherup, and I work for Michigan Medicine as well. I think we're going to head into some questions here to make sure that we're able to answer as many as we can before we run out of time. But I just want to throw a couple things out there from the adult perspective. As my co-panelists have mentioned, unfortunately, the insurance requirements, well, they've laxed a little bit during this time. There's still a lot of requirements that we have to meet in order to obtain some supplies, particularly those pumps and CGMs. If you're on Medicare, we know that those are actually extremely specific and strict requirements, unfortunately, and those have not changed right now. So be patient with us, and your providers, your educators, your physicians, as we continue to work with you to obtain those. And as Jacinta mentioned, sometimes there may be redeployment of the employees that have been previously working to provide you with those supplies as well. So call early, call frequently, and stay on top of us as we all work together to make sure we get things. So I see we have a couple questions in here.
Hey, Emily, while you're looking, I'm just going to go ahead and add something. You hear me okay?
Yeah.
So there's a little bit of advocacy out there for children's special health care to actually start paying for copays for adults. with type 1 diabetes here in Michigan. It's totally ground level right now, but there's some hope because there's a state rep in the legislature right now from the UP who actually lives with type 1. So I'm going to go ahead and again ask Crystal to share my email address. If there are people here in the state of Michigan that are adults with type 1, or maybe just a caregiver, or maybe you have a young person with type 1 and you want this for the future, if you are willing to do some advocacy and write some letters to state reps and state senators, I will give you, instead of sharing it here, I will give you all of that information, because if they could open up, I guess there's they've already done it with other disease states like cystic fibrosis and hemophilia. So if they've already done it for other disease states, why not type 1?
Yeah, thank you for bringing that up.
Yeah. One other thing I wanted to point out is, Jacinta mentioned you can go to Walmart to get like MPH or insulins, right? But that aren't the analog or rapid acting insulins that you might be used to. The generic brands of the insulins, like Basaglar, is the same insulin glargine as Lantus, or Admelog, that works similar to the Humalog or Novolog. Those are very reasonable to use interchangeably with the insulins you probably are familiar with too. All right, it looks like Jeff, you addressed this already. We have questions saying it would be nice if healthy living accepted United Healthcare. I think you answered that in your presentation, but
yeah. A real quick answer to that is we would love to do United Healthcare. We would love to be a provider for United Healthcare. They have a closed network similar to BCN, Blue Care Network in this state. A lot of times insurance plans will choose to pick one or two providers, or even a single exclusive provider. And unfortunately, when that, we have to continue to try to make a point to them that that's not in the best interest of most people with type 1. And we do that every day. We have a staff that actually work, that's their sole job, is to continue to call on those plans. But we love to provide as many people as we could. And unfortunately, when they have exclusive contracts, they only come up a couple times every couple of years. So we'll keep working on it.
So I see a couple of questions on here about the Children's Special Health Care. So is there a time frame for retroactively signing up for Children's Special Health? So for instance, if I sign up now, how far back in 2020 will it go? So yeah, so there is retroactive reimbursement when you enroll. So enrollment, the way that it works is typically it's annual based on the time of enrollment, so not calendar year. So if you sign up in July, the next following July, you'll be re-enrolling and basing that off of your potentially different tax filing for that year. The retroactive reimbursement, when you fill out your application, it says date you want coverage to begin. It typically will go back about 3 months or so. We've seen some a little bit more, but definitely it depends on who's billing it and which bills you're talking about. Typically, once you have that ID number and you're enrolled, then you can give that ID number to your healthcare provider, to your pharmacy, to your durable medical supplier, so long as they're one that can bill Children's Special Health Care, which you always want to verify. And they should be able to rebill whatever they can retroactively based off of that ID number. Pharmacies, I will say, like community pharmacies, sometimes we've had to call CVS or Walgreens, and there may be a pharmacy tech or someone who's not familiar and doesn't know that you can bill back more than 2 weeks with that because it's under the Medicaid umbrella. So we have to kind of just walk them through that, or get a pharmacist who knows to kind of step in and do that for them. And then Children's Special Healthcare has their own Magellan sort of reimbursement process for outliers and things too, if needed. And your team and hopefully your advocate or social worker or CDE can walk you through that process.
Looks like we have a question related to difficulty getting through to the durable medical company, not the one Jeff's affiliated with.
Oh, good, because I got a nice little plug I didn't get in, so.
Yeah, right. For instance, cannot get through busy lines, Dexcoms arrive late. It's a struggle every month. At what point do I switch suppliers? I recommend to my patients that whenever you are unhappy with the your provider, your supplier, right, you're in control. You're driving the boat here. So we highly suggest that you would contact your insurer. Remember, this is in Michigan especially, often primarily driven by your insurer, where you can go to receive these services. But contact the insurance company and find out where else you can go. Tell your provider, your physician rather, that you're interested in switching, and I would switch as soon as possible then. Keeping in mind that I'm not going to say may not be better, right? But everybody struggles to a certain extent. There's a lot of paperwork that all the durable medical companies have to process. Working with one or another, you may or may not find benefit that you're looking for. It depends on what the issues are. I think the customer service issue that you're dealing with here, there's probably better options provided that your insurance company allows you to go with them.
And I would just add to
And
that.
I'll say healthy living is fantastic.
And I would add to that too, when this comes up for our patients, we will recommend that you do let your voice be heard to that company. And I know some people get so exasperated, the last thing you want to do is call back, but I will say that your voice means so much more than ours or anyone else's. So if you call and you file a formal complaint or grievance, it gets logged, it gets recorded. And then if enough people do that, that's potentially impetus for change. And then I would also say, if your insurer does not allow you, does not contract with anyone else, we've gotten to the point with some families where I'll have them actually call their primary insurer and have a representative or a case manager from that insurance directly deal with the durable medical supplier, because then it's sort of hands-on, like real time, you can see what we're dealing with, right? Things tend to happen a little quicker that way, or you tend to at least get a break or more support. And then, reaching out to your diabetes team too, because a lot of times we have our own direct contacts there. And so we can utilize those people to kind of get things done faster, which isn't necessarily how it should be, right? But that's kind of how it ends up going sometimes.
Yeah, those are all great points. You guys actually stole a couple pieces of my thunder. But I will just add in that one little plug for us at Healthy Living. I've been flabbergasted. We had an operations manager who almost had the forethought of preparing for this here in Michigan. We were basically the first day we were able to go 100% fully staffed from home as soon as this took place. And that's a testament to one of our true dedications to the patients that we service. It was actually planned for snow days. Who knew it was going to be for a global pandemic and we were going to be home for 4 or 5, 6 weeks. But we're happy that that's been going on, and we haven't missed a phone call. We haven't missed an email. And as far as the other suppliers that may be missing calls, not returning calls, I will just say this. I'm not going to talk badly about them, but I will say this. And from my perspective and my industry experience, the bigger the company gets, the harder and the more difficult it is. The systems and the bureaucracy, the levels of bureaucracy that get put in place to take care of people with type 1, especially full line DMEs. And I mention this all the time to people. I say, especially like a full line DME, imagine as a customer service person taking a phone call for adult diapers, and then maybe, I don't know, some asthma medication or something. And then the next call that they take is you talking specifically about a specific piece to their insulin pump, a specific supply, a specific CGM. They don't have the knowledge or the wherewithal to pivot and tune to that. Unfortunately, that's the way that happens, and it's sad. But again, every company I've ever worked at, including Healthy Living, we constantly are educating and updating and giving our customer service team additional knowledge to better understand what you're going through and why you need your things right now, both with disease state and the products and services. So, but I will just give one more thing is, again, if my email is posted on here somewhere, even if it's with another company, if you have problems, I now, because I have worked at different places throughout town, I do have what I would consider rock stars or advocates at other companies. And I will gladly, if we can't help you, I will gladly try to get you in contact with those particular people, because those are going to be the people that go with bat for you when you do need those supplies.
All right, we're at our time now. I want to thank you all for being online. I will send you the questions after, and actually I'm going to be online for a few minutes. If you guys, when you mute and turn off your videos, you can still type in answers to those questions and it will go out to everyone. And I'll leave the room open for a little bit for you to do that, because then it will also go into our history. And that way I can get these answers out to them if they're not still on. Thank you so much, all three of you, for being a part of this tonight. It was a really informative panel, something that is so necessary for everyone right now. Everybody has insurance worries of various times. So thank you so much. I appreciate it. And I want to thank you, all of you that have joined us tonight. It's been great to have you with us. I did learn, apparently the text act to 5371 has been deactivated. So I'm going to find out what the right thing is. And when I send the follow-up email, I'm going to include that information, because we would certainly love you as an advocate, everyone as an advocate. This has been a great evening. We're back on again tomorrow night and on Thursday night. I hope you join us. And then we're also streaming live to YouTube. We've got tomorrow one more night of Kids Camp on Facebook Live. Thank you all so much. Have a great evening.
Thank you.
Thank you.